Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Vida Reed. Vida graduated from George Mason University in 1995. She has worked for many years as a research nurse in the areas of women's health, heart disease, and diabetes. She became a certified diabetes educator in 2001. She is a member of the American Association of Diabetes Educators and the American Diabetes Association. Vida has been at Washington Hospital since July 2006, serving as our diabetes program coordinator.
Tonight we're going to talk about goal setting. And we call it SMART goal setting, not because there's dumb goal setting, but SMART goal setting is an acronym for what we're going to talk about tonight, S-M-A-R-T. So let's get started. The objective for the night is for you to be able to identify health goals and develop an action plan for accomplishing those health goals. Which of the following diabetes goals do you think has the best chance to make a difference in your health right now? I want to lose 40 pounds. I want to lower my A1C. I want to cut second helpings for the next month. So how many say number one? Number two? How about number three? Number three. So let's see. While number one and number two may be great objectives to aim for, number three has the makings of a SMART diabetes goal. I want to cut out second helpings for the next month. So what we're going to talk about tonight is why is that a SMART diabetes goal for you or for someone who's trying to improve their health when they have diabetes. Think of a SMART goal as good health habits that move you closer to the place that you want to be with your diabetes care. So good health habits that move you closer to where you want to be with your diabetes care. So SMART, S, specific. In order for a goal to be SMART, it must be specific. It must clearly state what it is you want to achieve. Sometimes it may also state why that goal is important to you. It can't be vague or general like, I want to get healthier. Those just don't work. You have to pick one specific thing that you want to change to get healthier and commit to it. So it has to be specific, not vague, but very specific. So that goal that we just looked at, let's go back. I want to cut second helpings for the next month. That's pretty specific as opposed to I want to lose 40 pounds, right? It has to be measurable, something that you can measure. And this applies to both the end result and the milestones along the way to get you to attaining that goal. It answers the question of quantity. How much, how often, or how many? Whether it's testing your blood sugar 2 more times a day, walking an extra 10 minutes after dinner, or just trying something once. It has to be measurable. I'm going to try broccoli once. I don't like it, but I'm going to try it. You don't like broccoli, huh? He's shaking his head. Okay, I'm going to try broccoli once. I was recently until Monday in Thailand, and I tried a lot of foods once. So it has been said that what cannot be measured cannot be managed. So if you don't have a measure for how much, how long, or how often you're going to do something, you can't really manage it because you don't know when to stop or how far to go. It must be action-oriented, and some people use the A, they say it's achievable or attainable, and some say achievable and attainable, same thing, but we'll talk about why they might be just a little bit different. A good goal involves doing something. You have to do something, take some action, make something happen. So you got to do something, right? You can talk about, wanting to do things and planning to do things, but if you don't actually do something, then you haven't really attained your goal. You should ensure that your goals are achievable, and they must be believable to you. You have to believe that you can manage what you're setting out to do. Otherwise, you won't be successful at achieving the goal. So you have to believe that you can do it. It must be possible too. There's no point in setting goals that are not achievable. So it has to be something that's possible. If you had a hip replacement last week, it's very unlikely that you're going to start running next week. So that's not really achievable, right? But I do encourage you to not limit yourself based on what somebody else thinks you can or cannot do. It has to be something that you set for yourself, so that it's your own standard. So it's something that you set because you know what your limits are, you know what you're capable of, you know your strengths and your weaknesses. So just because someone else thinks you can't do it doesn't mean you can't do it. It has to be something you believe in yourself that you can do. It also has to be realistic and relevant. A goal that's realistic requires a little bit of stretch out of you, but not so much that you won't be successful with it. So a little bit of stress, but not so much stretch, so that the goal will be successful. It has to be relevant to what you want to achieve with respect to your health. So it has to be something that's relevant to your health. For instance, if you were setting a goal about diabetes health and you said, well, I'm going to, I'm going to read more books. That might be a good goal, but it might not improve your diabetes health. It might improve your vocabulary, improve your attention span, but it might not improve your diabetes health, although it is still a good goal. So it has to be relevant with respect to your health and the safety targets for diabetes care. The goal for blood pressure when you have diabetes is less than 120 over 90, I believe it is. No, 80. Less than 120 over 80. So to have a goal, I'm going to have my blood pressure be less than 100 over 70 might not be a good goal for you because you've exceeded the targets for health. And so you might cause more harm than good. And some people really do believe that if low is good, then lower is better. So you have to be careful of setting goals that are beyond what you should be setting them for with regards to safety. You can be tempted to do something just because it's easy and it's simple, and it sounds great, only to discover that it has no long-term importance for you. So it has to be something that's important to you, something that maybe you may have struggled with in the past, something that you've been wanting to do that's going to improve your health. So it has to be something that's, going to give you some bang for your buck too. Slashing my A1C in half is not a good goal to start off with because you may make some health changes, you may make some health changes, but you can't guarantee that it's going to slash your A1C in half. So that's not really realistic because you can't measure that, right? And if you don't do it, you might feel like you failed. And when you feel like you failed, sometimes you give up and you take a few steps backwards before you can get started again. The man with insight enough to admit his limitations comes nearest to perfection. So it's not going to be perfect, and you may have setbacks, but it's really important to get back up and try again. Timely, T. It ensures that you put a time frame to your goals. Start with a short time frame, allows you to try it out without a long-term commitment. You can always extend the goal. If you're successful at it for a week, well, I'll do this for another week. Well, I've been pretty good at this. I'll do it for another week. Well, I've gotten pretty good at this. I'm going to add something to this goal. So you can always modify your goal as you go along, but it's really important to start with a short time frame and add to it as you go along. No time limit, you really don't have any urgency for getting started. I'll start soon, I'm going to get on top of this. Oh, maybe next week, maybe next year. The first day of the year, I say every day you get up is another opportunity to do something different. You don't have to wait till Monday. You can always start on Tuesday, Saturday. You don't have to wait till Monday. But when you have a time limit, it gives you some urgency about, okay, I need to get started. I need to get ready for this, right? Simply deciding when you're going to start something or do something can be a huge motivator for you, because failing to plan is planning to fail. So it's good to have a plan and have a time frame on that plan. So we've talked about SMART. The SMART goal must be specific, measurable, attainable, realistic, and have a time constraint on it. When are you going to do it? How long are you going to do it? And so forth. So reaching a goal requires a lot of different things. You might find that you've been really successful at the goal, and so maybe you'll extend it. You'll add to it. You'll do it for a little bit longer. You might find that it's been a challenge and it's time to revise the goal. That's a part of the process too, even though it's not one of the acronyms. That's a part of the process, is evaluating where you're at with your goal setting, and you may decide that, hey, I need to change this goal. One, it's not giving me what I wanted it to give me, and it's been kind of hard for me to do it, or it's too easy. I was already doing this. A lot of times when we're in class and patients are setting goals, they'll write down a whole list of things they're going to do initially, and then we regroup and we talk about it and things get revised. But, it's not about having a whole lot of things to do. It's about choosing at least one thing that you want to work on and working on that one thing. But you can work on multiple goals too. You can have more than one goal at a time to work on. That's okay, as long as you're able to manage that without an increase in your stress. Because this should not be stressful. It should be something that you're enjoying working on. Even though it's a challenge, it's something that you're enjoying doing, and it should make you feel good about what you're doing. Because 90% of the care that people with diabetes receive is self-care. So being able to set goals for your self-care behaviors will give you a lot more success in your management of diabetes. Working on goals in different categories is okay. You may be working on a goal with healthy eating. You may be working on an exercise or activity goal. You may be working on a medication goal. You may be working on a healthy coping goal. So you can work on goals from different categories. And not everybody needs to work on eating goals. I mean, some people do, but if that's not where you're ready to make changes at, or if you've made all the changes in your plate that you're going to make, that might not be where you want to make goals at. You might want to work on something else. You might come back around to healthy eating, but maybe that's not where you're at right now, and that's not what you're willing to change. When you force yourself to do something because somebody told you it was good for you to do, you're not typically very successful with it. Exercise is another one of those goals that can be a difficult one to pick up, but if it's something you're ready and willing to begin to work on, it's a good place to start. But if you're not ready, maybe it's not a good place to start. I mean, the doctors tell us, the educators tell you should eat healthy and you should exercise, but if you're not ready to do those things yet, you have to get ready to do them to be able to be successful with them. So you can work on goals in different categories, and you can bypass things that you're just not ready to deal with yet. You can bypass that and work on something else. Because you're still going to get some benefit if you exercise and don't change your diet. You're going to get some benefit. Of course, we'd like to see you do all of those things, but realistically, you may not be ready to. So you have to start where you're at. And once you've achieved your goal, you want to reward yourself, Share it with your friends. Go out for a special evening. Buy yourself a new book or a new pair of tennis shoes or something, or even go out to a nice meal with your friends or your loved ones to celebrate the small accomplishments that you're making your goals, because they're really important. Even when you do something small, it's still very important to reward yourself and acknowledge your accomplishments. So let's look at some goals. I'm going to put some up, and we're going to talk about bad versus good goals. I don't really like to use the word bad, but it seemed like the only word to use. I could have said appropriate and inappropriate, but those words didn't fit on the page. So bad versus good examples of SMART goals. So let's see. I want to lose weight. Bad or good? Better good. Okay, so we could rephrase that goal, right? So that might be your aim. You really want to lose weight. That's your aim. So, and it's okay to have that as your aim, but how are you going to lose weight is the question you have to ask yourself. And that's where goal setting comes in. Wanting to lose weight is a desire, it is an aim, but it's not the goal, because wanting to lose weight, if that got us to lose it, we'd all be, anorexic or something. We'd all be very thin. So, but that's not what happens. You have to set a goal to get to that aim. So, more appropriately might be, I want to lose 20 pounds by August the 1st, 2012. I will do a half hour of cardio and a half hour strength training 5 times a week. I will only eat starchy vegetable carbohydrates 3 times a week. So that's a more realistic goal, a SMART goal, because it talks about what you're going to do, how often you're going to do it, and when you're going to do it. So that's an example of a SMART goal. And to lose weight, you do have to target your activity, your food, and your activity and food. You have to target those things. Now, you might put into place, I will do a half hour of walking for your cardio. I'll do a half hour of swimming for your cardio. Whatever the activity is that you want to do, I will only eat starchy carbohydrates. Well, you might want to put a specific carbohydrate in that place. For instance, if you like potatoes, and you eat a lot of potatoes, that might be the carbohydrate you'd put in that place. I will only eat potatoes 3 times a week, or rice, or whatever that indulgence is, macaroni and cheese. I'll only eat it 3 times a week, because losing about a pound a week is what they say is safe to lose. So between now and August the 21st, 20 pounds is about a pound a week. So that's an example of a SMART goal. Does that make sense to everybody? Okay, let's look at another one. I will not eat rice, or I will cut back on rice at dinner. So, what do you think? Is that a SMART goal? No, not a SMART goal. Let's see what makes it a SMART goal. I will have a half serving of rice at dinner for the first week. I'll have a half serving of rice at dinner for the first week. So it's short term. It's a short-term goal because, I really like rice. So I know I have it every day, sometimes twice a day. So I will have a half serving, half of what I usually eat, that's measurable, at dinner, that's the time frame, at dinner, for the first week. And after the first week, I can reevaluate that goal. Was it working for me? Was it not working for me? Because if I'm having a half serving, if 3 times a week wasn't working for me, maybe then I'll have it, I'll have it less, even I'll have it a little bit more, But it's important to set the time frame, the quantity, what it is exactly that you want to accomplish. So let's try another goal here. I will run 30 minutes every day. Is that a SMART goal? Mm-hmm. It's a SMART goal? Do you already run? You already run. So that's a SMART goal for you, right? Now, if somebody wasn't running already, is that a SMART goal? Probably not if you're not already running, because running is pretty tough. You got to start out walking first. So it may not be a SMART goal for somebody who's not running already. But if you're already running 3 times a week, and you're going to run now, you're going to up it to every day, that might be a SMART goal for you. You're going to run 30 minutes every day. But if you're not currently running, you might not want to start with that goal. And this is an example of a goal that can go either way. So if you're not running, to make it a SMART goal, you might want to say, I will walk 15 minutes after dinner every day. So you'll walk 15 minutes after dinner every day. So you start with walking, and then you do that for, let's say, even if you didn't put a time frame on this, you just said after dinner. But if it's a new activity for you, you might say, I'll walk 15 minutes after dinner for a week or for 2 weeks, and then reevaluate that, maybe add another 5 minutes to that walk. So let's look at some more of these goals. That's what we're going to do at the end. We're at the end, I'm gonna ask you guys to give me some goals, and we're gonna try to work together, if it's not a SMART goal, to make it a SMART goal. So I thought I'd go through some examples to kind of warm you up and get you used to the idea of SMART goals versus not SMART goals, to prepare you for that. So we're gonna do some little practices. If you have a goal in mind, we can all try to work together to make it a SMART goal, because I don't have all the answers. You guys can help me with this part of it. The staff, actually, I asked all of them to give me a couple of goals and give me a good one and give me a bad one, to kind of get some examples on the table, so I would have their input, based on what they see and they deal with their patients. I will say no to all desserts. This is a more realistic goal for me. I will have dessert 2 times a week, on Friday and Sunday. Now that's more realistic for me. So that's more realistic, right? So that way you enjoy sweets, you enjoy desserts. So you set a time where you can actually enjoy it and not feel what? Deprived, guilty, deprived. Yes, you set a time where you can actually enjoy it. So when you do have it, you can savor it, right? And really enjoy it. Because if you're anything like me, you beat yourself up. Oh, I shouldn't have had that cake. I shouldn't have had that pie. Oh, I'm stuffed. And I feel horrible about it, right? So then I spend, a couple of hours angsting over it, and then, the next day I do it all over again. So we can't be doing that. I will stop eating tortillas and everything white. Now this is something like your goal over there. I will stop eating tortillas and everything white. I imagine if you eat tortillas, it's probably something you've been eating your whole life, because it's one of those foods that's kind of connected to our heritage, right? You eat tortillas, and it's probably connected to your heritage, and you're saying you're going to stop eating them. Your mother ate them, your grandmother ate them, her mother ate them, and her mother ate them before you, and you're going to stop eating them. That's not very likely. I mean, it's a lofty goal, and you can certainly give it a try, but it might not work for you, and you may end up overindulging in those kinds of foods when you are exposed to them. A more realistic food goal might be, I will eat breakfast 3 times a week. I'll make sure I eat my breakfast. That's more realistic. And with regards to stop eating the tortillas and everything white, you might want to look at, how do I make healthier choices in these categories of foods? How do I eat healthier foods? Like, for instance, if you eat white potatoes, you could switch to yams or sweet potatoes. They have more fiber, they have the color, so they're going to not raise your blood sugar so much. You can choose a whole grain or a whole wheat tortilla. You can eat less tortillas. Maybe you eat 3 at a meal. Maybe you can eat 1 or 2 instead of all that you've been eating in the past. So it's really important to try to avoid setting goals that kind of go against who you are in some ways. Especially, obviously there's some things that are based on our heritage and what we've always eaten that may not be good for us. But there are some things that we eat. We can make healthier choices with those foods and still continue to enjoy them on the holidays and when we're with our families. We can still continue to enjoy those things. I will start swimming every day. So that's the goal. Start swimming every day. So the question you have to ask yourself is, do you have regular access to a pool? Is it affordable? And can you swim? Because if you got to take swimming lessons before you can swim every day, then you're going to be a while getting to that goal, because first you got to learn how to swim. So some goals require us to ask ourselves some questions. I'm going to work out every day after work. Well, many times during the week you work late. You don't get off. So you got a built-in excuse. I worked late. I couldn't exercise. So you have to prepare for that when you're setting your goal. You prepare for events that you know might happen. If you're going to exercise every day after work, you have to say, well, how often am I having to work late? And if I have to work late, what's my backup plan for that day? What am I going to do differently? Maybe on the days that I know I'm going to work late, I'll take a walk during my lunch break. I'll use half of my lunch break to go for a walk. Or maybe if I'm exercising Monday, Wednesdays, and Fridays, and Wednesday I am not able to exercise because I worked late, I'll make it up on Thursday. And if I can't do it on Friday, I'll make it up on Saturday. So some goals require us to examine our ability to achieve the goal based on our other obligations. I will start swimming for 30 minutes 3 times a week at the senior center. So you've said where you're going to swim at, how often you're going to do it, and for how long you're going to do it. So that's a more realistic goal if you're already swimming and you have regular access to the pool and you know how to swim. So let's see, we got a couple more here. I will test my blood sugar every day. Does everybody here test their blood sugars every day? You don't have to raise your hand, but yeah, okay, you test every day? All right, that's good. Well, a lot of my patients don't test every day. A lot of my patients don't test at all. And so a more realistic goal is I will test my blood sugar twice a day before breakfast and 2 hours after dinner. So you've identified when you're going to test your blood sugar, so you're more likely to keep that up. The other thing, remember I talked about the goal being realistic and relevant? When you're testing your blood sugar, it's really important to understand why you're testing your blood sugar, the timing of when you're testing your blood sugar. For example, if you were to test your blood sugar right after you had dinner, it's not really going to tell you anything. It's going to tell you what we already know. Your blood sugar went up. It's supposed to go up when you eat. That's natural. Whether you have diabetes or not, your blood sugar is going to go up when you eat. So if you test right after you've had dinner, you're going to get a high reading. So, and if you're relying on that to determine how well you're doing, you might be disappointed, and disappointed unfairly, because you should test your blood sugar 2 hours after you eat. That way, you know that the blood sugar should be back to where it started at 2 hours after the start of the meal. So it should be relevant to what you're trying to find out. I will not forget to take my medications. Smart goal? If your memory is anything like mine, I don't know how you're going to achieve that one. So more realistic would be, because if you rely on your memory and you're already forgetting it, you're not going to be successful and you're not going to feel really well about that goal. More realistic might be, I will use a pill organizer to help me remember to take my medications. That's a more realistic goal for remembering to take your medications. And it's actually a good tool to help you remember, because one of the things it does, it puts them in, the little spaces, and you can look and you can see a visual, oh, I didn't take them. And it reminds you to take them. And also, it can help you be able to see how often you're missing your medications at the end of the week, and you still have 3 or 4 little spots still filled with pills. And that will be a motivator that says, wow, I didn't realize how often I miss my medications. I will take care of my feet. So, well, it's important to take care of your feet, but when will you take care of your feet, and what will you do to take care of your feet? Well, I will check my feet for changes at bedtime every day. So every day at bedtime, you're going to inspect your feet, look at them, look for changes, and make note of the changes if you see them, and you can see how things are progressing. So that's a more realistic goal. I will not get upset easily. Yeah, that works for us all, right? And as soon as we think we have it under control, we go off the handle, right? So more realistic might be, I will identify someone to talk to when I am upset. I'll find somebody when I'm feeling overwhelmed, feeling stressed, feeling upset. Maybe I'll call my sister, call my spouse, call my girlfriend, my friend, and talk to them about it. And maybe not even about it, but just talk to them about something else to take your mind off of what's stressing you out. Because we know that stress plays a huge role in your control for diabetes. So coping is really important in managing your diabetes, and having a plan in place, somebody you can rely on and talk to and lift you up when you're feeling down or upset, goes a long way in improving your health. So let's get smart. Let's talk about some of your goals. I think she has a microphone, so she's going to bring the microphone over to the nice lady here in the red. She said she had a goal that she wanted us to look at and think about working on.
I want to be able to go out to lunch with my coworkers when they go to a Mexican restaurant, but every time I eat Mexican food, especially if I have any amount of rice whatsoever, my blood sugar is way too high.
Okay,
So
so
that's a, I mean, that's what the problem is, but I don't think it gives me
it's
something to do about it really.
okay. Well, let's talk about that because we know that interacting with our colleagues and with our friends, it brings us a certain amount of joy. We feel good when we're interacting with one another. So if you're denying yourself the opportunity to interact, you might feel sad when they all go. You might not feel good when everybody's gone out because you can't enjoy it. And if you do go and you eat it, you feel bad because you didn't want to do it. So let's see. She wants to enjoy food at a Mexican restaurant with her friends. Has anybody in here made any changes in their diet that they can share with her that will help her think about that goal a little bit? Anybody made changes in their diet that they struggled with or anything? Anybody? Over here? He said something. Wait for the microphone.
Just order a bean and cheese burrito.
He says order a bean and cheese burrito, huh? Anybody else got anything to add? Up here in the front, we've got somebody. So we've got order a bean and cheese burrito. Okay. She might not like beans.
Mexican food is my favorite food.
Okay. Okay. She says Mexican food is her favorite food.
And what I do is I get a salad and I modify it however I have to modify it. Make sure there's some chicken in it for some protein. Add some beans to it, but I request just pinto beans, not refried beans. And no cheese. And I don't eat the chips and the salsa. Well, I eat the salsa, but not the chips. And that works really well for me. In fact, Mexican is my favorite place to eat. I have the easiest time selecting something to eat.
I like that. She sounded like a dietitian. I like that. You know, and one of the things that dietitians tell patients, and I have to disclaim, I'm not a dietitian, I'm a nurse, but one of the things I hear them tell patients is to order a la carte. Because if you order a menu item, you know, a set plate, it's going to come the way they serve it. Or, you know, everybody's ordering, you said, oh, hold this, hold that, don't do this, don't do that. You know, and everybody's kind of like looking at you like, oh, da-da-da-da-da-da, when is our food going to come, right? So, you know, ordering a la carte really helps with that. And as she was saying, she could tell you better than I can because she's been doing it. So did those things sound like something you could do?
I liked your suggestion about the burrito with making it a bean and cheese or meat, because I actually tried that. I asked them to make me a burrito one time, but no rice in it. And the tortilla and the beans were enough to raise my blood sugar too much. I mean, realistically, for me to do that very often. But this, you know, customizing one of their salads would be fantastic.
Yes.
I think that would work.
And starting with the salad kind of fills you up so you have less, you know, and have an appetite by the time the food comes out. Skipping the chips and the salsa is a really big deal. And, you know, beans are a carbohydrate, so they definitely raise your blood sugar. But using the chicken as the protein, having more chicken, it's a lean meat, and it doesn't raise your blood sugar, will give you the protein that you need without having so much of the beans, so half and half kind of thing, and then cutting out the rice. I think that's great.
Well, you know, I can tell she must be further along in it when she said she left the cheese out of the salad. It's like if I put cheese in something, you know, it's like that may not be good for the cholesterol, but it certainly isn't bad for the blood sugar.
Well, you know, when you have diabetes, you got to weigh all the odds because, you know, when you have diabetes, you have a risk for heart disease and high blood pressure and heart disease. So you got to protect your heart. And sometimes the fat in the cheese can affect the heart. And also, when a meal has a huge amount of fat in it, your blood sugars will stay up longer. So if you cut back on the fat, your blood sugars will come down faster, if that makes any sense. So they're going to go
I thought
up.
that when you had the cheese that it took the digestion a little longer, so the things that raised your blood sugar didn't let the sugar get into your bloodstream as fast.
Well, if it's digesting a little bit longer, you probably is going to sit in your bloodstream a little bit longer too. So the fat actually
okay.
it stunts the drop in the blood sugar, so it goes a little bit slower. You're going to go high for it, depending upon what you ate, and you're going to stay higher for
Okay.
longer as opposed to coming down sooner when you
Okay.
have a lot of fat in your diet. So it's really important to cut back the fat to protect your heart.
I happen to be a big eater, and my wife keeps telling me to cut down. When I cut down, I get hungry in the middle of the afternoon or before I
Okay.
go to bed. And in the morning, the same way, if I don't have a big enough breakfast, I get hungry in the morning somewheres along the line. I've lost a lot of weight, however, and I used about 25, 30 pounds, something like that. And I still, there's certain things I like that I want to eat because I was raised with them many times, so you stay with what you like. And I don't know what to do about it.
Okay. Now, is your wife here? Right. Is he giving you a hard time? All the time, huh? Okay. Well, they say married men live longer than single men. So that nagging really helps. It keeps you alive. Did I say nagging?
But I don't like to hear it every night.
Well, let's see. So, again, I'm not the dietitian, but I'll open it up to the floor first, and maybe you guys have a suggestion or some comments for him. Up here, we got a man up here. He's gonna try. He's got a wife with him too, so he might have some help for you right here in the front.
My problem is a little different from his because my problem is low blood sugar, but I think one of the things you've told me in the past is to increase your snacks. And I think that's an appropriate thing both for adding the carbs when you're in a low end or actually extending or quelling your appetite in between the times, because if you plan your snacks accordingly, you're actually going to be very healthy, but they will fill you up.
Okay, so how's it working for you?
Pretty good.
Pretty good. Any more hypoglycemia?
Yes, but
It's less?
I keep trying.
You keep trying?
Yeah.
He keeps trying.
Yeah.
Okay. So what he's basically saying is this. You were talking about you like to have a big meal and you get hungry later. So one of the things you want to, I'm not going to give you all the answers because we charge for this. Okay? I'm just kidding. So one of the things is that you have to look at the meal and make sure it's a really well-balanced meal. If the meal is heavily either one thing or the other, being that carb or protein, it can make you hungry later. It's really important to have a balanced plate, a plate that's reflective of carbohydrates, protein, and vegetables. Because if you're eating a whole bunch of carb, your blood sugar is going to go pew, pew. It's going to go up and it's going to plummet. And when it plummets, you're going to feel very hungry. And if you're taking medications, you're going to feel very hungry. So it's really important to have a combination of carbohydrates and protein on that plate so that you get more bang for your buck, for starters. That's one of the things you can look at. The other thing, as a gentleman up front said, is you want to look at having some snacks in between your meals. You don't want to go, if you have diabetes, more than 4 to 5 hours without eating something. So if you have breakfast, let's say at 8 o'clock in the morning, round about 11, maybe 11, you should have a snack. And I'm not talking about, half a pizza. A snack would be a piece of fruit and a handful of nuts, a piece of fruit and some string cheese, some crackers and peanut butter. That's a snack. So then when it's time, you don't get so hungry before the next meal. And when you do get to the next meal, you don't feel so ravenous and you don't overindulge. So you kind of slow that appetite down by feeding it gradually. So you feed yourself more frequently, more frequent small meals.
I have a problem late at night, like watching TV, where I want to munch.
Mm-hmm.
And all during the day I do really well, but then at night it's like kind of all hell breaks loose. I mean, not that bad, but I start out with one thing and it's like, no, that's not what I wanted. And it's not all carbs, I try to keep it. I mean, it's nothing bad. It's not like a candy bar or anything like that. But what I kind of thought of is to have a goal of, if I do have an evening snack while watching TV, that it has to be vegetables, and maybe some hummus or, some kind of low-cal dressing or something, unless my blood sugar is low, and that's the reason for the snack. But my snacking is just because I'm watching TV. And
Okay. They go hand in hand.
it's horrible. Yeah, sometimes I munch on sunflower seeds, which I don't know how good that is, and probably, sometimes I have like a full bowl of seeds thing, so it's probably would be okay if I didn't eat that many sunflower seeds,
Right.
But I figured if I limited myself to vegetables and hummus or something like that, and that's all I can eat,
Well,
that might help.
A part of goal setting is knowing yourself, knowing your strengths and your weaknesses. And it sounds like you've identified a weakness as watching TV in the evening makes you want to snack. You're not really hungry, you just want to snack. So looking at some ways.
I can convince myself I'm hungry.
You can convince yourself you're hungry. So choosing some healthier snacks or healthy snacks will go a long way in preventing weight gain and rises in your blood sugars. One of the things you talked about, the mound of nuts. Sometimes when you put them in little individual packets, you package them in the amounts that you want to eat, and you'd have to get up every time and go get another package. That might slow you down a little bit.
Even with like sunflower seeds?
Even with sunflower seeds. We talk about healthy oils, we talk about healthy things, like nuts are healthy, but when you eat the whole bag, you've negated the healthy part of it. So you still have to manage and balance that too. Fish oil is good, but you don't want to drink a gallon of it. So that's one of those things you want to quell. And you're right, choosing, if you're not hungry, you've eaten your meals, you've had all the food you're supposed to have for the day, choosing healthy vegetable snacks is good. Slices of cucumbers, with something light like hummus, that's a good choice. I think it's a good choice. But you still have to limit it, obviously. Eating too close to bedtime can cause us to have heartburn as we get older, so you want to watch that. You don't want any other problems on top of the ones we already have, right? So those are good choices. Thank you all so much for your time. I really do appreciate it. I just want to encourage you to reach for your goals. The sky is the limit. And I want to remind you that our diabetes education program is open. Your physicians can refer you to it. It does require referral. You can meet with the dietitian if you're really having some concerns about your diet and you're struggling with something and not quite sure how to manage it. The dietitians can help you come up with a plan for being able to manage your diet. At least give you a blueprint for how you should do it. And if it, you might have to modify it as you go along, but it will at least give you something to follow, right? So, without further ado, I say thank you, and this is it.